Mm-hmm.
Hi, Facebook Live. If anybody's out there yet watching on Facebook Live, if you could give us a thumbs up and let us know that you can hear us. We have a microphone now, so we're hoping to avoid any further sound issues from our Facebook. And we're just letting people in on Zoom, so we'll give it just another minute or so before we get started. Actually, what we'll do is we'll go ahead and introduce ourselves. And so my name is Angela King. I'm the owner and clinic director of Indian Acupuncture and Functional Medicine, and we've been here for 14 years now. So certainly a new time in our business, but we are weathering the storm just like everyone else. And this is one of my associates. I'm going to let her introduce herself.
My name's Amanda Milian. I've been with the practice for almost 2 years now. I run the community acupuncture room. I also do a lot of the cosmetic acupuncture that we offer here. So I'm excited to be visiting you guys on this new platform that's going to become our new norm.
Yes.
And it's a good day for this topic. It's Earth Day. So we're talking about Chinese herbal formulas. They come from the earth. This is the medicine that we use from the plants. So I love that we're having this today.
Yes, and we have talks scheduled all the way at least through the end of May right now for different topics as they pertain to health and certainly as it relates to the COVID pandemic. And then we're going to plan to continue those probably weekly once this moves forward. So we can it's nice because in the office, we never have time. We do spend a lot of time with our patients, but we never have time to talk about all of the different things that we do and all the things that we do have available. So doing these talks is going to give us an opportunity to continue to explore that with you guys and help you know what's available in terms of ways that you can take care of your health and optimize all your functions in your body. Okay.
Cultivate your chi.
Cultivate your chi from a Chinese medicine perspective and a functional medicine perspective.
Yes.
Okay, so we're going to go ahead and get started, and then if anyone else joins in on Zoom, we'll just admit them as they come. Okay, so today our topic to us is exciting because it's really about getting back to our roots. So of course our core training is in Chinese and herbal medicine, acupuncture, and the various branches of Oriental medicine. So getting back to our roots today, this has been an opportunity to do that really with the COVID-19 pandemic, because we've been studying all of the research that's coming out of China. We thought at the end what we could do is go back, and we're going to put these on a YouTube channel, which who knew we'd do that. But we're going to do that because the videos are being recorded on Zoom. Oh, I think it is. Let's see. There was like a button that said,
oh,
there it is right there. Okay.
You just have to let everyone know that they are being recorded.
Yes.
Y'all are being recorded.
Okay. So we're recording them so we can post it to YouTube. The videos are too large to email, so we'll post it on YouTube, and we'll post references for our talk today because there are really quality research references to back up and support what we're saying. We've spent so many hours reading these articles, these journal articles, listening to these webinars. And one thing I want to start by saying is I think what's important is when you really want to know what's happening from the medical perspective, like forget the politics, forget all the theories, forget those things. Really, if you want to know what's happening with the health of people, you talk to the doctors, you talk to the people who are treating, who are on the front lines, who are just there to do their job. They're there to try to help people, to get them better at all costs. And so we've watched multiple interviews with doctors on the front line in China. They're all in Chinese, and then we get the subtitle translations. We listen to the herbal formulas that they're using. We listen to their process, what they're seeing, what they found to be effective, what works, what didn't work. And then one of our particular teachers in Chinese medicine, John Chen, he has been spearheading a lot of the efforts to translate the research. His team has been translating the research that's coming from the medical journals in China. And we find that to be extremely helpful. He's doing webinars. I mean, there was another one this afternoon. He had 180 slides. I mean, let me just show you. We were going to show you guys this so you could see. John Chen wrote are two herbal textbooks. You can see the thickness of this. If anyone's having trouble sleeping, please just ask to borrow a copy. But this is just one. And John Chen wrote this. He is not only an Oriental medical doctor, but also a Western pharmacologist. He has a PharmD. This is just the one on single herbs. So first year and a half of school, we learn 1.5 years of all the single Chinese herbs that are used in formulas, right? What they do, what their actions are, what they treat, okay? Then in the second year and a half of the 3-year program, we move on to this book, which you can see is even thicker. And this is the Chinese herbal formulas and applications, that also written by John Chen, the pharmacist and Oriental medical doctor. So this man knows what he's talking about, and he knows how to understand the pharmacology of herbs. And like we said, he's the one that's bringing a lot of this research to us so that we can help disseminate it to you guys. So first we want to talk about herbs in general. So whenever you are going to take a Chinese herbal formula, you do want to make sure that you are getting a quality herbal formula by a reputable company. Okay, so yes, there are poor quality Chinese herbs out there. Some of those are the ones that are found over the counter in Asian grocery stores, for example, will sell like the little tea pills, the little black round pills. And to be honest, those are not really the ones that you want to be taking. There have been studies that have shown that those can be contaminated, and even contaminated with over-the-counter pharmaceuticals like Sudafed in the ones that are for cold and flu and sore throat. So we don't recommend those, even though they're inexpensive. They are not worth it, because you just don't want to take things that have been contaminated. So any good acupuncturist, practitioner of Chinese herbal medicine is going to use reputable quality herbal products. Our line that we use most often is Evergreen. It's actually formulated by Dr. John Chen. So we respect him so much. We utilize his formulas. And all of the companies, though, here in the United States that are good companies, they test the herbals that come in. The raw herbs are tested for contaminants. And you can go to the companies and get information about the testing, the results of the testing. They do liquid chromatography, mass spectrometry. That ensures the active ingredients are in the herbs, and it ensures that there are no contaminants. So they're tested for things like pesticides, herbicides, bacteria, heavy metals, mold, fungi, and even over-the-counter pharmaceuticals. So they're all tested and all clearing. So you want to make sure that you are using a quality product, because that is important. So next, Amanda's going to talk about how herbs are delivered, how they're actually formulated, and how the delivery methods can be done for you to consume them. And I think it's really important to understand that, because a Chinese herbal formula is different than what we are used to here, where it's sort of like you focus on the one aspect of the disease, like a bacteria, and you find one agent that will kill that bacteria, and that's the drug, right? Or you focus on hypertension and you interfere with one receptor and the blood pressure lowers. So this is different. There's an elegance and an eloquence in designing a Chinese herbal formula that has been, how they've done it for 5,000 years. And so Amanda's going to talk about that. And so I'm going to turn it over to her for a moment.
Yeah. Hi. So I like to think of a Chinese herbal formula almost like a recipe. There are a lot of different components, and when they come together, it creates something that's bigger at the end than it would have, with that synergy, than it would have been with all of the ingredients individually. So a formula can be a combination of different individual herbs. They can be delivered a few different ways. The most common and traditional one is to decoct it, which means to steep those herbs raw in water. And it needs to actually be in a certain kind of pot, a ceramic pot or stainless steel, so there's not any kind of chemical reaction. It's a little bit of a process. There's usually a boiling and a steeping and a draining and then maybe another boiling, which is why it's not done as often in America. But this is a traditional way that a formula is created, steeped, and then made into a tea or a soup, and then that's administered to the patient. And that can be diluted down a little bit for taste and things like that. And what Angela was saying is the beautiful thing about creating herbal formulas is that they can be specified for each patient. And by combining the individual properties, you can treat the person's condition more specifically to help reduce or release the side effects from other herbs, also to treat multiple conditions all at once. And as the patient progresses through their treatment plan, you can modify that herbal formula as well as certain symptoms are resolving and as we move into more tonification or other treatment principles. So that's why herbal formulas are so wonderful, because they can really be customized for each patient. And I love what Angela said about that inherent beauty of those TCM formulas, that the ingredients are balanced in a way that promotes the synergy effect. So at the end of the day, we treat a combination of different things and helps get the patient better faster. So the way that they break it down is there's 4 different helpers, 4 different components of the formula. They're known as the chief, the deputy, the assistant, and the guide, or we know them more traditionally as the emperor, the prime minister, the minister, and the envoy. So that first level of herb is going to be the one that treats the most primary symptoms. It's going to be your chief herb, if you will, the bulk of that formula. And then that's going to be to help to work directly on the etiology and the pathology, so those most concerning symptoms.
Yeah, then like your chief complaint.
Yeah, your chief complaint. So if a fever is what you're coming in for, or the shoulder pain or whatever, it's going to directly go to work on that. Then that's the emperor. Then the prime minister is going to help to enhance the results of that emperor's job. Also help to control some of those chief complaints. Then the minister goes in to help treat secondary symptoms and to minimize any of the effects of that emperor and the prime minister. So if there might be something there that might be a little bit too strong, then that third guy goes in there to help sort of modify and tonify so everybody's playing nice. And then the last one is the envoy. It's the herb that can be used to moderate any effects, and it also can help to adjust the taste, which sometimes can be a little bit bitter, but it also can be sweet. It just depends on that combination of herbs. So that's a decoction. And then you can move into a granule. So again, that takes a couple of days. That's only a couple of days worth of formula. So just to make things a little bit more convenient and more effective for us to get into our bodies, we do granules, which are the decoctions that are then freeze-dried and granulated. And those can be mixed with hot water and then make a tea like that. Those also, can be modified a little bit with the strength and the dosing, things like that. And then more commonly even is to just create those granules and put them into a pill form.
Capsules,
yeah.
And capsules or tablets.
And this is what that bottle would look like. These
right.
are filled with the capsules.
Right. So I think it's important to remember that, because when you see like an herbal formula and you take a capsule of that, right, it is not just like the twigs and the berries or the leaves, or the roots ground up raw and put into that capsule. It's actually gone through that process of being decocted, right? Being decocted. So the synergy and the blend of all of those herbs have been created together, and then it's freeze-dried, right, and granulated and put into the capsule. So Americans typically like taking capsules. We're used to that. But in China, everything really is done mostly by decoction. And they're used to taking their twigs and berries home from the herbalist and boiling them up on the stove and drinking it 3 times a day.
And then you go back and do it again a couple days later.
Again. Yeah. So that's just an interesting history about how Chinese herbs are manufactured. So let's talk a little bit about their classification of the action in the body. And this starts getting into how it relates to COVID-19. Okay, so we do want to be careful to say that unfortunately the FDA, which we understand their reasoning, is really coming down on hard on anyone trying to say that they're doing things to prevent or treat COVID-19. Because there isn't any one agreed upon treatment or anything to technically prevent it. So what we want to talk about is what has been done in China with studies and research to back it up. We can talk about reduction of risk. I think that's important just in general. I don't think even calling something preventive medicine is even good. There's nothing that any of us can do that if we do that specifically, we can 100% guarantee ourselves we're never going to suffer from a chronic disease or we're never going to become ill. So instead, we should really be talking about reduction of risk across the board, right? How do we mitigate risk? How do we improve our immune systems and our overall health so that we reduce the risk of acute illness, in this case with COVID-19, or chronic disease if we're on to different topics, right? And then in terms of treatment, again, what we'll talk about here is what has been done in China effectively with statistics behind it. And we'll just say that this is what they're doing to treat people with COVID-19, not to treat the virus itself, right? Because as you guys can see from even just the news, you'll see so many different manifestations of COVID-19. You'll see different people having different symptoms, progressing to different stages of the disease. So it really is, even though it's one virus, right? Although there's several strains of that particular virus, we know, but it's still the people that get the disease that you need to understand how they're manifesting those particular symptoms so that that Chinese herbal formula can be best matched to their symptomology, right? So in Chinese medicine, the early stages of the COVID-19 viral illness, or any viral illness, right, for that matter, is considered to either be a wind cold or a wind heat type invasion. So in Chinese medicine, you have the different ways that disease enters the body, okay? And one of them at the early stages is it's through wind. It's on the means it's at all that means is that it's invaded from the outside, and it's at the superficial layer, or what we call the exterior, right? Yes. So, and that's also the defensive level. Amanda's going to talk about that in just a second. So we typical symptoms that would be, this would be your early stage of a viral illness. So headache, sneezing, sore throat, right?
Allergic, like an allergic response almost, those kind of symptoms. That's why it's kind of confusing when you think about COVID, because it could just be one of those things.
Could be
a malaise, a headache,
right, malaise, myalgias, which are muscle aches and pains, just feeling lethargic, run down, tired, that sort of thing. So you've got all of that, invading your exterior, something's going on. And the fever's typically mild at this stage, right? So 99.4, 99.6, 100, like a very mild fever. So that's considered the early stages of the disease. And there can be either wind cold or wind heat. Some people will get more of the runny nose that is bland, meaning, it's kind of a clear color or maybe even a little bit whitish. Other people right away might have signs of yellow, or their tongue might be a little bit red. Their fever might be slightly higher, that sort of thing. Their throat might be more sore versus scratchy, right? So a scratchy kind of throat can be more of a wind cold. A really sore throat might be more of a wind heat. So at this stage, we have specific herbal formulas that we would give someone to help try to keep that disease, like stimulate their body's response enough to keep that disease and push it out of the exterior for them to get well. So sometimes herbal formulas like that in Chinese medicine, there's something called Gegen Tong, there's Yin Chao San. So these are just Chinese medicine names of herbal formulas that your practitioner is going to be very familiar with, and that would be a starting place, right? That would be like the first signs of getting sick. That would be what we do until we see something change. And if we see something change, as it often does in COVID-19, we see it move into what we would call the chi level. And I'll let you talk a little bit about how that becomes more of the interior heat signs.
Sure. So there's 4 different stages when you think about disease from the heat perspective. And as Angela talked about, that first level is defensive. Then we move into the chi level, which is more of like the energy, then the nutritive, then the blood. So at that chi level, there's more of a severity that's increasing with the heat, the inflammatory response in general, especially in the airways. There's a shortness of breath. They start to get more of that, like a kind of a wheezing and
cough. The cough can become
a little bit more respiratory, just distress in general. It's moving more from that lung heat into a lung cold. It feels like a heaviness. As it progresses even further, it will become a little bit more unproductive, and that's what we call a damp phlegm component. So it's kind of heavy, and it's just not able to get anything up, and you really feel that heaviness in your chest.
And we know that that corresponds to what's happening in the actual viral illness, because as COVID moves into the lower respiratory tract through replication and assistance from the ACE2 receptors that line the lungs, you start to build up this pressure, this difficulty. It starts to get into the alveolar sacs. where gas exchange happens with carbon dioxide and oxygen, and there becomes pressure, there becomes pulmonary fluid buildup from leakage and damage.
Fibroblastic plugs.
Fibroblastic plugs, yes. So that it gets very difficult. It gets damp in there. It gets heavy. It gets phlegmy. And that phlegm isn't easily expectorated oftentimes in COVID. So people start to develop these pneumonias, right? This pneumonia, this particular type of pneumonia in COVID. And then if the illness is not resolved from there, it moves into the next stage, which for us is the yin stage, right?
Or nutritive
stage. And things just progress from there and on into the blood level.
That's where that cytokine storm starts to kick in, and multiple organs get involved, and it becomes much more severe.
Right. And that's when, you're lowering your chances of survival at that point. So that's sort of the progression, and Chinese medicine has a way that it matches up with what actually we know about how the virus can progress in individuals that have contracted it, right? So there's different interventions that can be done at this stage with herbal medicine. So in China, they talk about the four stages of when to use herbs. And really the first one is, in China, they would say prevention. Here we'll say reduction of risk, right? So there were studies done that have been reported from Hubei Provincial Hospital, which is one of the big hospitals there, and then also Wuhan, their main hospital, which is where we listened to some interviews with doctors and herbalists on the front lines there, and then also in the there's guidelines from the National Commission of Health for the People's Republic of China. So those are there's many studies to read. There's PubMed studies that have already been published with these different herbs that we're going to talk about next. But these are hospitals that have reported utilizing this and having very good success with their patients. So in terms of what they did at the Hubei hospital, and let me say this, okay, so they've also learned a great deal about what to do from the original SARS epidemic. We know that this virus, SARS-CoV-2, is very, very similar. The viral genome is extremely similar to the SARS-CoV-1 that was the epidemic back in 2002, 2003. So they know, they've already been through this, right? So they've already had these herbal formulas in place. They know what to do. They act very quickly. They take it seriously over there. And so their results, maybe one of the reasons their results look a little bit better than ours. So the formula that they gave to all of their healthcare workers. So this is, let me back up. This study was from hospitalized patients with confirmed COVID-19, okay, at one of the Hubei hospitals. And so that hospital acted very quickly. They got their herbal formulas together. Every patient was given an herbal formula, and that was changed as their symptoms progressed. But also what we're talking about is that their healthcare workers and their staff were given a different formula. And that formula is called Yu Ping Feng San, okay? That's what this one right here is. And so the way this was done at their hospital there was, it was actually the herbal pharmacies that make these decoctions are on premises. They're on site, on location. And the healthcare workers, from the doctors to the nurses, anyone that's on shift or on staff, when they come onto their shift, they first report to the pharmacy. They're given their dose, okay? And that's recorded, because if they're not taking it properly, they're considered a risk to the hospital, and they're considered a risk to other patients and other staff. So the pharmacy actually controls the dosing and administration of these particular herbal formulas for their staff and their patients, okay? So this particular formula was used, and it's given at the beginning of the shift and at the end of the shift. They have to take it every day. They're required to take it. And in that particular hospital, no healthcare workers got sick. And this is a very classic formula that's being used across China. It's been used across China for thousands of years, but it's especially been used to help build immune resilience for these types, particularly these types of outbreaks or epidemics. The main ingredient in that particular formula is huang qi. Okay, and huang qi is the Chinese herb for astragalus. And so some of you may wonder, well, why shouldn't I just go buy astragalus, off the shelf somewhere, I guess, or order it on Amazon as we do these days? And one of the reasons that goes back exactly to what Amanda was talking about earlier is the synergy of this formula of Yuping Feng Sun and how they can also then modify it to fit what's happening with this particular epidemic. So if they see more fever, more sore throat, more things like that, they'll often modify Yuping Feng San and add a little bit more herb to clear heat, clear exterior heat, soothe the throat, that sort of thing. So that is one of the main formulas, and we have been using that with our patients here. You want to talk about that for a minute about
Yuping
just
Feng San, sure.
Yuping Feng San and how the only problem is with really supply, but yeah.
Right. So Yuping Feng San traditionally, as Angela said, it's been used for thousands of years. It translates to jade windscreen. So at the change of season, especially in the fall, when we become more susceptible to coughs, colds, and flu, they would actually put up a jade windscreen to prevent some of that cold and wind from coming in. As we had said, this is a wind heat or wind cold exposure that is that first level of pathogen. So COVID in particular is a wind heat. But Yuping Feng San traditionally been used for centuries to help people to strengthen their immune system and generally be more reduced risk of more resilient in general of catching some of those pathologies that come about in the fall. So like she had said, Huang Qi in particular, it helps to stimulate your body's own T cells and then the B cell production, which is what helps to create those antibodies.
Yes.
Correct, Miss Functional Medicine? Excellent. So those things are happening just with that one herb. And then as we continue to add the Prime Minister and the Minister and the Envoy, those again help to create more of a synergistic effect to strengthen the lung in particular, to strengthen the gut health, so that immunity where it's stemming from can get the proper absorption from the food. The food you're taking in is being broken down and absorbed in the right way. So all of these herbs together help your body to function at its best to really help to keep you strong against pathogens and to strengthen that outermost layer, that defensive layer, so your body again just isn't as susceptible to those things getting in the first place.
Yes.
That's the preventative stage or early stage.
Early stage. Yeah, so that would be more what you would use to try to reduce your risk of contracting COVID-19 or the virus. So basically that herbal formula, if you are not in Vero and you have an herbal medicine practitioner, Chinese herbalist, that would be the formula that you would want to ask for and be instructed on how to take it. One of the things that we wanted to mention about dosing before we move on to the next formula is that dosing in Chinese medicine herbs is always quite different than Western herbs. So when we tell somebody to take 12 capsules a day, they're like, "Whoa, 12 capsules a day? This sounds like so much." But remember, it's about having to get what you would get in cups of tea into these small capsules after the granules have been freeze-dried. So a traditional decoction, you want to get about 6 grams of the herbal formula into you a day. And to get 6 grams of an herbal formula, most of the capsules contain about half a gram of granulated extract per capsule. So that's why it typically takes, for the average adult, anywhere between 150 and 200 pounds. They're around, average age 45 to 65, you're looking at about 12 capsules a day. If you're a little older, if you weigh a little more, that dosage gets adjusted to a little less or a little more, depending on those particular statistics, your own body, your age, those sorts of things. So Chinese herbs are very specific and very customized in that way.
And what I always like to say about herbal formulas, though, even though it might seem like a lot at the end of the day, it's a plant, it's a food, basically. So even though it might seem like, oh wow, 12 capsules, you can really know that there's only 5 or 6 herbs in there. They're very recognizable. It's a flower or it's a tree or something like that. So
yes,
it's safe.
It's safe.
Safe.
Yes. I mean, it has
well
to be
tolerated.
Right. And that's the other thing, though, is you do want to make sure for this particular herb, Yuping Feng San, it is very, very well tolerated by most people. The only people that should not take that are people who have autoimmune disease or possibly are on immunosuppressive drugs from organ transplant or maybe a severe autoimmune illness. And that's because the Huang Qi, the astragalus, is so powerful at tonifying the immune system or strengthening the immune system. That's what your immunosuppressant drugs are trying to do. You don't want to overstimulate someone's immune system who has an autoimmune disease because their immune system's already overreactive and sort of attacking the body, its own self in some way. There's another herbal formula. So you may have heard that some patients with COVID-19 will present with gastrointestinal symptoms first. So we've seen varying statistics on this. It's upwards of the highest statistic we've seen is up to 30% of patients will present first with nausea, diarrhea mainly, occasionally vomiting, but it's more of this like anorexia, this lack of appetite, not wanting to eat, nausea, and particularly diarrhea. That is a particular form of dampness in Chinese medicine. We think of dampness as anything sticky, heavy, and that could be phlegm and mucus, but it could also be diarrhea. So that particular formula, Huo Shang Shen Qi Shang, I know it's a lot of names.
A lot of shushing.
A lot of shushings. That particular formula is meant for the early stage of that. So when you present with the diarrhea first, to try to help your body resolve that and keep you from getting a more advanced form of the disease. So with the Chinese herbal medicine, it is different in that everything needs to be customized and reviewed to make sure you're on the right herbal formula. Mm-hmm. It's not a one-size-fits-all approach.
And that actually, when it's in that level, it's already moved past that exterior level and it's already getting into some of those internal organs. So you can also look at it like that. It's already progressed a little bit further, or it's just manifesting in somebody a different way.
Yeah. Yeah, so some people do get that in the early stages.
Mm-hmm.
Okay, so then what we want to talk next about is if you do become ill and you have progressed through these early stage symptoms, maybe you tried a formula and you got worse, or maybe you got sick and it kind of hit you strong in the beginning. Okay, so what happened in China? This is very interesting what they did. Okay, so because a lot of hospitals in China have both in the same hospital an integrative department. They have their Western branch and they have their Eastern branch, where you actually have the herbal pharmacies and you have the Chinese herbalist and herbal medicine practitioners and acupuncturists. You have them on staff. You have them at the hospital at the same time. We watched videos of the medical doctors leading the way and the herbalist like right behind them, going and checking on patients, doing rounds. They would adjust and change the formulas at the hospitals that had the capacity to do this, right? To individualize the prescriptions. And 3 days later, if that particular formula needed to be tweaked a little bit, they would tweak it, change the formula, keep moving on. The statistic is that the leader of China, Xi Jinping, he declared near the end of January that all hospitalized COVID-19 patients would receive herbal treatment. So it didn't matter what province of China you were in. It didn't matter where, and the government provides these herbs for their patients and for the staff, so accessibility is not a problem over there. So from the end of January, all of the patients that were diagnosed and hospitalized with COVID-19 did receive herbal treatment. The success rate that is in the statistics is around 92% of patients receiving herbs. So think about this, right? What happened was, as you guys all saw, the epidemic evolved, the pandemic started as an epidemic, evolved into a pandemic so quickly that Wuhan could not handle all of the patients that needed to be hospitalized. So you saw all these sort of makeshift hospitals go up very quickly, and to house and take care of the patients who were sick. So imagine that they couldn't just, install herbal pharmacies, right, in these makeshift hospitals. So they had to come up with a solution. And they had to come up with a solution to treat the masses of people with herbal medicine. So what they did was they had observed enough patients at this point, and also remember, they also had the SARS epidemic of 2002, 2003. So they had observed enough about this particular, what was happening in these patients and the people who didn't make it and what was making them so ill. And they took 4 classic Chinese herbal formulas and they combined them into one, okay? And the resulting herbal formula is called Qing Fei Pai Du Tong. And this is the one of the references we'll give you of an article that was published in PubMed that showed Qing Fei Pai Du Tong had about a 91% efficacy in terms of treating patients who had COVID-19. So one of our distributors, Comwo Herbs, was spearheading the production of Qingfei Paidutong in the United States, which, let me tell you, is it's an event. Every acupuncturist or Chinese herbalist in the United States is trying to get their hands on this to have for their patients. So we have it. We have a limited supply, and this is actually a decoction. So you can see, I don't know if you can see from the back, but yes, it's brown in color. But this is a liquid. This is BPA-free plastic bags. The herbs are all inspected. They cook them up, and this is exactly how they were delivered to sick patients in China. So you take 2 of these packs a day for just 3 days. That's it. Mm-hmm. And in most cases, symptoms resolved. They never went beyond 6 days of treatment. So they might do another 3-day course of treatment of taking a packet of this twice a day. You put this, actually immerse this into warm water, and the whole packet. And so it becomes, like a warm tea, and then you pour it into a cup and drink it, okay? So this particular herbal formula, Qingfei Paidutong, has 21 herbs in it, and it's the blend of herbs that help, all of these herbs have specific actions to, we say, descend lung qi, okay? So the lung qi is supposed to go down. You're supposed to inhale a breath. The breath is supposed to go down, okay? So when you inhale that lung qi, it grasps, it roots inside of you, and then it circulates around to your body. Well, when the lung qi is rebelling, okay, it comes up in the form of cough, and it comes up in form of wheezing. So there's herbs in here to descend lung qi, to help wheezing.
Cool the blood, bring the fever down.
Yes, there's also an herb in there called shigao. Shigao is a very strong Chinese herb that helps really reduce fever. So we call that an antipyretic herb. So that helps reduce the fever component. There's herbs in there, chai hu. That herb is known to be very liver protective. We've seen now that COVID-19 can damage the liver. It can also cause neurological and cognitive effects lasting after COVID-19. There's also herbs in there that help strengthen the blood. As some of you may have seen, COVID-19 can also cause a lot of clotting. They've seen that now after they've done post-mortem studies where there's clotting or disseminated intravascular coagulation, DIC, on a lot of these patients. So there's herbs in this formula that help to prevent that from happening. There's also herbs in this formula that transform phlegm. We talked about phlegm and dampness, as it's called in Chinese medicine. So there's herbs in that particular formula that help transform that phlegm, right? And let's see, descending lung qi, stopping wheezing, cough, phlegm.
What I think is amazing about this formula is there's nothing new in Chinese medicine, right? As we said, thousands and thousands and thousands of years. Until now, this is a new formula based on 4 traditional ones, but it's pretty exciting that we have it. And we are familiar with all the herbs that are in it. As we said, they're based on traditional formulas. So it's effective for a lot of the different symptoms for a majority of the people. It's not going to treat everything for everybody in the same way, but as Angela has indicated, it was met with great success in China. So this is what we have. If you or anyone you know becomes ill, we can first line of defense.
Right, and we would do herbal medicine consult, telehealth first, and that could be as simple as a 15-minute conversation with one of us over telehealth, or 30, or just depending on how many questions the person has and how sick they are. But because Chinese herbal medicine is not a one-size-fits-all, and there are very potent herbs in these particular formulas, they do need to be monitored. They need to be prescribed by a Chinese medicine practitioner. So that's, we're constantly monitoring the different herbal supply companies to see when they get back in stock of certain things. So we have that particular formula in a decoction, about enough for 40 people, and we have it in a powder formula, enough for 12 or so more people. And we've already used it with one patient. We had a girl around 20 years old. She was around other people that were diagnosed COVID, had actually a positive COVID-19 test, and she that was traveling with them, and then she became symptomatic upon her return, tight chest, wheezing, that sort of thing. So we did give her the formula. Her mom got back in touch with me the very next day and said she was already the chest tightness had relieved. She was feeling much better, and she never progressed on to illness. I mean, again, that's a study of one, but this is an herbal formula that has been, like we said, broadly and widely used in China specifically for the COVID-19 pandemic.
And then the Yuping Feng Song, Angela ordered 350 bottles, and by the time the order got placed, we ended up with 25 or something. So as she said, the supply is very, very limited, but we have it in a few different forms. We have it from another supplier. It's called silver flower.
No, that's the that's the Qingfei Paidutong. Flower. We have con herbs,
but we have a couple of different forms
herbs.
Of the Yuping Feng Song. It's the same ingredients. Formula. Yeah, it's the same formula.
So we did get more shipment, but we did get more herbs than the 20 as we were checking different suppliers and able to source them from different quality vendors. But yeah, when we were like, great, we're gonna have enough to treat like 120 people, and then it was like we got 20 bottles. Ugh. So, and some companies aren't even going to be back in stock till the end of May or June. But the other thing to consider, we want to just wrap it up and thank you guys for your attention. We'll take any questions if you have them. But one of the things that we do want to be prudent about is, you're starting to hear now about the possibilities of restrictions being relaxed and the economy opening back up and people, sort of starting to go out and about and in stages, or who knows, maybe it's going to be all at once, right? So we don't know yet what it's going to look like when that happens. We don't know yet. No one knows, right? But they're expecting a second wave of this. You probably read that. And whether that comes quickly, if too many people get back out into the community all at once, or if things sort of settle down and then we see another wave, which is what Dr. Redfield of the CDC is expecting, another wave in the winter time to be coinciding with flu season, then these herbal formulas are necessary and helpful long term. So don't forget about them, even if you may not use them now. Typically the fall is a good time. If people take a break over the summer and things do seem to, let's say, chill out a little bit, then around September, October, that's when you'd want to start back on your Yuping Feng San, or, getting your immune system more resilient, as we say, and prepare for in advance and not be proactive instead of reactive, right? None of us had a lot of time to be proactive in this particular crisis, although we've done what we can. So we basically want to do everything we can as this moves forward and as we understand more what may happen as time goes on and as people may become reinfected, either reinfected, which we don't know, or if we get that second wave, or if numbers start going up when people start opening up and getting back out in the community again. So if anyone has any questions, Zoom, you can type it into your chat or unmute your mic for a moment. Or if anyone on Facebook Live happens to have a question, you can type it in your comments. And otherwise, we would let you know still that if anyone didn't catch our talk on Saturday, we do have antibody testing available. You can contact the office, call us, email us, Facebook message us, Instagram, DM us. I mean, good Lord.
We can get in touch.
Yes, you can get in touch with us if you're interested in antibody testing. And then on this Saturday at 11, we're going to do a really big talk on functional medicine strategies for the COVID-19, right? So for immune resilience specifically. So functional medicine looks at things a little bit differently. There's a whole bunch of research going on in that direction. There's just so many ways to help yourself. And I think that that's really been our biggest mission, is to understand that we feel that if you were to get sick, or even before you get sick, there are strategies that have evidence-based research behind them to put into place that can at least help you to try to stop progression from getting severely ill, right? So we want to see as many people, if people do get this, that they get sick, but they resolve it. They're sick, they're ill, but they resolve it and they move forward with their lives, right? So instead of just waiting around and being sick and having nothing to do or no strategies in place, we're trying to offer you options that you can try to help yourself get better. Let's see. Oh, Lisa, we can't wait for you to come back too.
Hi, Lisa.
Transfer factor immune. Okay. So yes. So let me see. There might be another question about that
There's
too.
another question about transfer immune.
Okay, so let me address this for patients. Transfer factor immune. Okay, so transfer factor immune is it's similar to Yuping Feng San, but it's more of a functional medicine approach. Okay, so there's a couple of different ways you can do this, and both of them are right. Okay, so transfer factor multi-immune, if you've been taking it, you should continue taking it. You should continue taking Yuping Feng San until we see for sure that we are on the other side of that curve, especially once the economies start opening back up and people are back out in that community. You want to make sure that those numbers are still down before you stop taking your immune boosting supplements. So Sarah, the transfer factor multi-immune is slightly different than Yuping Feng San, but essentially they both do the same thing. And if you have an autoimmune illness, what can you take to assist with prevention? Okay, so we're going to talk about that a little bit more on Saturday, because that fits the functional medicine paradigm a little bit better than the Chinese medicine paradigm, just for our approach and strategies. We'll talk about things like resveratrol and zinc and different formulas that are safe for people with autoimmune illness, that still can play a role in in trying to mitigate that cytokine storm. And so if you tune in on Saturday at 11, or if you can't make it, check our new YouTube channel. Weird I'm saying that. And you will be able to access that after the Saturday talk as well. We'll post that up there. Let's see. Okay, so how does a person with a hyperimmune response prepare their immune system? Great question. And I hate to keep saying we're going to talk about it on Saturday, but we are going to talk about it on Saturday, and I don't want to overextend our time today.
You could also talk on the future talk we'll do is also about acupressure points that you could do to help with that, and moxibustion. So we could, and if you want to talk privately about that, we can give you a few different tips on how to strengthen your immune system.
Yes,
from some Chinese medicine
right.
perspectives
So
as well.
yes, exactly, because there's things we don't want to do with somebody who has an autoimmune or a hyper reactive immune system. We don't really want to do things to directly stimulate the immune system, but you have to think of it like this, and we'll talk about this more on Saturday, but a little teaser, okay, is immunity is made up of more than just one function, okay? So it's not just increasing natural killer cells, it's not just increasing T cells, it's not just increasing IgA. There's a robust way that your immune system works, and there's ways that you can support your immune system without overstimulating it for the people that need to be more cautious due to an autoimmune disease, and we will get into it on Saturday, I promise.
And I like to say that is what we talked about in the beginning as far as cultivating your chi. And that is just a good lifestyle practice. I like to tell my patients that acupuncture and self-care, qigong, all of this, the supplements, the formulas that you take, those things that you do on a regular basis, if and when life hands you this mental, emotional, physical trauma or, COVID, then you're a little bit better prepared to handle the effects of it. You can take care of yourself, your family, and friends. You have a little bit more strength and resilience, so it doesn't affect you as much, or you can recover from it that more quickly. So again, all of these practices are things that myself and Angela and the other practitioners do on a regular basis. So you're always just prepared for whatever.
So I have one more question here. Are the immune boosting herbs compatible with a regimen of B and C vitamin minerals? Absolutely. Yes, absolutely, 100%. That's what we're recommending with our own patients here, is to do the specific immune boosting herbs along with some of the functional medicine strategies, which would include certainly your vitamin C and some of the other nutraceuticals that we'll discuss on Saturday, because they all have a different role to play. But the Yuping Feng San, specifically the one that we're talking about today, the immune boosting herbs, that one in particular, yes, it's absolutely jade windscreen is its common name. That one is compatible with vitamins and minerals and most other medications that a person's taking. There's no interference with that. It's like we said, the only contraindication with that formula is someone who's on immunosuppressants from organ transplant or autoimmune disease, or has a known autoimmune disease. So, okay, we thank you guys for watching and tuning in, and we will be back on Saturday 11. Saturday morning at 11, I'm actually going to have our third practitioner with me that time, Chelsea Dodd. She has a master's in clinical nutrition as well as being an acupuncture physician and doctor of Oriental medicine. And we're going to spend some time on giving you at least the top 10 supplements with research-based evidence behind them to talk about the functional medicine strategies, and we'll talk about that immunity so that you guys understand it a little more, that it's not just one pathway or process in the body. It's a synergy, it's an orchestra. It's really complex and yet very exquisite and eloquent, and we want to support it the best we can. So all right, thanks for tuning in. Y'all have a great day.